I am Dr. Gregory Foray, a medical officer working for the Ministry of Health and Sanitation in Sierra Leone. I got a recommendation by the Ministry of Health and Sanitation in collaboration with the Office of the First Lady to pursue a one-year fellowship course in pain and palliative medicine organized by Krishna Institute of Medical Sciences, deemed to be University, India. Sierra Leone generally is a small country with 7.5 million people. At the moment, the country does not have any designated center for providing cancer care. Rather, we are basically using the main adult referral hospital for providing services for cancer. The statistics for Sierra Leone shows that we have about 3,000 people who develops cancer each year, and 2,000 of those people will die of the cancer per year. Those deaths are basically attributed to the late presentation to the healthcare facility. But the challenge is, even if they would have presented earlier to the hospital, we have limited diagnostics facility in the country, and even if there are diagnostics, it might be very expensive that the patients cannot afford. Coupled with the fact that we also have limited treatment modalities. For the entire country, we do not have any radiotherapy facility, and we have the expertise is mostly absent. At the moment, we have just one surgical oncologist and one clinical oncologist who are currently stationed. The only good thing is we have 2 other colleagues who are currently undergoing training sponsored by Merck Foundation in Egypt, one as a medical oncologist and the other as a surgical oncologist. So those 2 will help boost up the human resource for cancer care in Sierra Leone. Providing care for cancer is like a multidisciplinary team. So with the oncologist, with the oncologist, both the medical and the surgical oncologist, their work should be complemented by the palliative care physician. So currently in Sierra Leone, we do not have any palliative care physician. So most of the patients who present to the facilities very late with advanced disease, with no hope of cure, do not have the opportunity of being seen by a palliative care physician to provide the kind of comfort care that is needed for these patients. So for these reasons, I think the training for palliative care physician is really very important, not only for Sierra Leone, but then for Africa as a whole, because we do not have the kind of sophisticated machines. Patients are presenting very late to the facility. So the gold standard should be improving on the palliative care services of these patients. So we give them the kind of comfort, we improve on their quality of life, and then we are actually able to relieve them of their pain and suffering. So before this time, once cancer is diagnosed, it's like the patient has been given a death sentence with nothing basically to do for these patients. So apparently, to change these dynamics, I think, so one of the things that are very much important at this point is to improve on the human resource, the expertise of these doctors, the nurses, and then the physicians to be able to care for these patients. So the critical things that are needed could be the human resource, as well as the infrastructure should be provided so we could be able to tackle these cancer diseases. The training in pain and palliative medicine at this point in Sierra Leone is really very much important, owing to the fact that these patients are coming to the hospital very late with advanced diseases. And with advanced diseases, so the only remedy would be providing palliative care for these patients, working with the patients through the journey of their disease till the end of their life. And palliative care is easy to establish and it does not require sophisticated equipment to practice. So the first step is to have the necessary expertise which Merck Foundation Oncology Fellowship Program has provided me. My expectation for the fellowship in pain and palliative medicine is to actually gain more skills and knowledge that will enable me provide the quality of care that is needed by my patients. And notwithstanding, advocacy as well as training should be on top of my priority. With my expectations to gain more knowledge and to acquire more skills, Krishna Institute of Medical Sciences, deemed to be a university, has provided me the adequate exposure in the various fields that are needed. The cancer inflow of patients in Krishna Institute is really very huge, and most of these patients are coming in with a huge symptoms burden. So the outpatient, the palliative outpatient department has been able to provide the kind of treatment modalities that is adequately helping the patients resolve some of the symptoms that are needed. Similarly, I have been exposed to a didactic lecture wherein the science behind the palliative care has been taught by the best teachers that we have available. Being able to get all the experiences, they have also been able to collaborate with other centers that provide palliative care to have exposure of the way palliative care is practiced elsewhere. So I was linked to the Trivandrum Institute of Palliative Care, which is the seat of palliative care in India, so that I can definitely have a first-hand experience on how they practice. So the home care services provided by this institution has been excellent in such a way that most of the patients that we saw on our home-based palliative care was not related to cancer rather than other disease condition. And I think this is very important for me coming from a country like Sierra Leone, wherein most of our beds in acute hospitals are being filled by patients with neurological disease conditions that will spend more time in the hospital. So with this exposure I have got so far, I think going back home I'll be able to advocate for these patients to be moved from the acute hospital so beds can be freed up for patients who are acutely ill, and then these patients can be managed at home on an outpatient basis with the palliative care team. And then consultations will be made to the hospitals again when needed. So it will be more or less like a multidisciplinary team approach wherein we see the patient alongside other physicians. So with no palliative care physician currently in Sierra Leone, I really hope to be a kind of resource material for the entire country, wherein I will not be only engaged in providing patient care, but to also serve as an advocate for the incorporation of palliative care into the general health care system, because once that is done, we know that will be the first step in palliative care training among doctors. So similarly, training of other healthcare professionals will be very much important, for which I think I can play a key role in that. Because the more we get more physicians, more nurses being trained in palliative care, I think comfort care can be guaranteed for our 7.5 million population. In terms of the general structure of the training currently, one of the things I will suggest from my experience is to ensure that more collaboration with other centers are being done. So once we have collaboration with other centers, you're able to be exposed to almost all the things that are needed for you to equip you enough to face the challenges that you'll meet in future once you get back or once the training is complete. So the new batch of students who will be aspiring for a fellowship in pain and palliative medicine will be, first of all, to consider palliative care not as a less lucrative specialty, but to consider it as important as all other specialties. If you currently consider the type of disease dynamics in our countries, you'll really put premium on the importance of palliative care. Therefore, taking this opportunity to be trained as a palliative care physician will put you in a better footing to be able to provide a comprehensive care for the patient. So you look above just the disease condition, just above the symptoms, but then you consider the patient on a holistic perspective, wherein the physical, the psychological, and the spiritual aspects of the disease are also taken into consideration. And honestly, what will happen is that you'll notice that it will be very much fulfilling, because you are actually adding value to the lives of these patients who are already dying. And you continue to be in a journey with the patient until the last minute of their life. So it's kind of so fulfilling. So I want to encourage my colleagues to really see palliative care as a new field, new emerging field that is very important as cardiology, as important as nephrology and other fields in medicine. Merck Foundation Oncology Fellowship Program, I must say thank you very much for giving me this opportunity and for giving this opportunity to my country that was in dire need of such an important specialty. And it will create a whole lot of difference. So to Merck Foundation, I must say it has been like a blessing to Africa, a blessing and a one that is sent by God, so to speak, to help those who are really suffering from this cancer, because it was like a death sentence before. So getting more people trained in various fields in cancer will basically help to bridge the gap in the services provided, the disparity in the care provided in Africa and that of our counterparts in Europe. Wherein if you're diagnosed of cancer, we know you can have the requisite human resource, the requisite expertise to be able to treat you very well. And rather than you being in Sierra Leone before, once you're diagnosed, you know you're going to die, because there is no oncologist there is no radiotherapy to treat you, there is nothing absolutely that is available. So with this eye-opening that Merck Foundation has given, we want to say a very big thank you to them, and we hope they will also provide this opportunity to more doctors, so the issue of cancer care can be taken much more important like they have done. I want to thank them very much.